Good morning, everyone. I'd like to call the meeting to order. Before I start, I just wanted to welcome the new director of the Worcester Division of Public Health, Solo Dennis. Welcome to the Shrewsbury Board of Health,
Good morning. Thank you so much.
and welcome to the Alliance.
Thank you.
So the first order of business is the review and approval of the minutes from the November 4th, 2022 Board of Health public hearing. Do I have a motion to approve the minutes?
So moved.
I'll second.
Okay, all in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Myself, aye. The meeting minutes for the public hearing are approved. The next item is to review and approve the minutes from the November 4th, 2022 Board of Health meeting. Do I have a motion to approve the minutes?
So moved.
I'll second.
Okay, all in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Myself, aye. The meeting minutes are approved. The next item is to review and act on proposed revisions to the existing Shrewsbury tobacco regulations and implement an effective date for any revisions. So the first item is the cap on the number of tobacco retailer permits. And as indicated by the meeting minutes, the board did conduct a public hearing on this proposal. And basically, what it has to do with is potentially increasing the number of tobacco retailer permits from 20 to some other number. I know we had a discussion on this in the previous meeting, and as I understand it, there were no further public comment on this issue, after the public hearing. So what is the pleasure of the board on this item?
And not to increase the number of,
I would second that.
I think we had discussed earlier that it seemed like it would be appropriate to maintain the previously determined number of permits in town and not make any special exceptions.
agree.
I would
Okay,
agree.
any further discussion?
Nope.
No? Okay, so do I have a motion to maintain the number of tobacco retailer permits in Shrewsbury at 20?
So moved.
I'll second.
Okay, all in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Myself, aye. So the tobacco retailer permits will remain at 20. The next item under that item is to codify the number of suspension days for selling tobacco products to an individual under the age of 21. And again, this is an item that's being incorporated or codified in response to a state requirement to have the suspension days as dictated by state law, state regulation. Do I have a motion to approve and codify the number of suspension days for selling tobacco products to an individual under the age of 21?
So moved.
I'll second.
Okay, all in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Myself, aye. So the item is approved.
And effective date, Steve.
Okay, thank you, Kerry. We also need to make an effective date for these new provisions. Is it something we can do effective immediately, or should we make it, say, January 1st?
What do you think?
It's up to the board. Both are possible.
Is there any logistical problem with making it effective immediately?
No, we just stated that whatever was decided at today's meeting, we would publicize it within a week of passage. So if I can get it to the community advocate today, we can have the legal notice posted on Friday, the 16th. that-
Okay.
Of the effective date. And basically, it's just the state stuff that we're now formally incorporating. So whatever you wish.
What if we did it, if it would be posted on the 16th, what if we did it for that following Monday?
It's fine with me. So that's
The
the
19th.
19th?
That would be
Okay.
fine.
Okay, so do I have a motion to make an effective date for the tobacco regulation changes effective December 19th?
So moved.
I'll second.
Okay, all in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Myself, aye. Okay, so the effective date for the tobacco regulation changes would be December 19th, 2022. Okay, the next item on the agenda is to review and discuss the coronavirus COVID-19 update. If Dr. Abraham or Solo, if you have any comments on the current status of COVID-19 in the Worcester area?
Currently, we are continuing to provide COVID vaccine and flu vaccine. I believe Dr. Hirsch provided an update. Currently, we are working with our partners in terms of making sure that encouraging folks to wear masks as much as they can in public settings. And in terms of our vaccination rate in the city, I don't have the most updated information, but I can definitely get it before effectively hopefully Monday.
Okay, thank you. Dr. Abraham?
So I was going to add that the community prevalence has gone up. Wastewater surveillance has varied between 1.7 to up to 2.6 million viral copies per liter of wastewater sewage, which is pretty high. To put in perspective, our low numbers are when it's around 0.6 per million to 0.8 million or 1.2. But so it's definitely gone up in the community. The number of hospitalizations have not gone up as much. However, what we're seeing is the elderly, again, 80-plus-year-olds who are coming into hospital with COVID, who haven't gotten the most recent booster, and unfortunately some of them succumbing to their illness. Paradoxically, what we didn't expect and what we are seeing more is RSV in adults, primarily parents and grandparents of children who have RSV, and those numbers continue to climb. So people with chronic lung disease who get RSV, get bad pneumonias, end up in our ICU, etc. So not so happy from a virus which had little publicity among adults in the preceding years, so this year. And if we look at data from the southern part of the U.S., definitely California overridden by flu, as in many southern states. And so we anticipate that in the next few weeks, as flu marches towards us, which is generally how the flu virus spreads, we should see our flu activity increase significantly as well. So clearly the coming together of all three viruses and their effects are being seen. It's not hysteria, but definitely a fact. And number two, that the RSV flu epidemic will have a major factor given our still struggling adoption rates of the bivalent vaccine. And as was mentioned by Solo as well, I think masking in public will become all the more relevant now because asymptomatic carriage is an issue. So we don't know who we are standing next to and who might be potentially be a carrier virus. So making for a dismal winter and concerns of healthcare staffing shortages compounding the pressures on hospitals to be able to turn around patients, etc. So hospitals are looking at things like hospital at home programs where they could be discharged from the emergency room, etc., to a home, back to their home, and then be monitored with paramedics visiting them at home, doctors doing Zoom calls, etc., so as to be able to decrease the pressure on hospital beds and especially rehab beds for those who don't need to be in a rehab or a short-term care type of thing.
Do we know what the vaccination uptick has been for flu?
Very good question. So I think our generally low rates, again, anecdotally, I don't have sure numbers. Some people adopt it, some people don't. There's also been this we continue to get these questions, can I take flu and COVID together? And the CDC has come out with it saying you can get them together. You can't, there is no waiting period between them, etc. But I think general, people's lack of appetite to get their vaccines. We don't know whether it's a reaction to the previous years of being asked to do it or whether it's just generally forgetting the fact that we're still in an epidemic which has not completely abated. So I don't think the uptake is great. Again, you see this curve. The seniors take more flu. The younger age group between 30 and 50 is sort of variable uptake. And I think some of the kids do because from past years it's more of a habit. But tougher, a little poorer adoption rates, I think this year, just anecdotally, I don't have numbers to back me up.
Okay, thank you. And in this regard, I just would like to remind everyone that the Shrewsbury Board of Health does still have in effect an advisory on the wearing of masks indoors, especially in crowded areas, so that remains in effect as an advisory. If there are no other questions, then I'll move on to the next item, which is to review and discuss updates from the Central Mass Regional Public Health Alliance. Micah?
Sure. I guess the first update would be that Julie Van Arsdalen did resign as of last week. So the city of Worcester does have positions posted, and we'll be working on rebuilding this office. So right now it's me, and then Phil Legere is filling in on Title V and assisting with that. So we're still out there working. Otherwise, it's kind of been the status quo. No real outstanding complaints. Market Baskets planning on opening sometime in January. And we did have one tractor trailer accident with a truck full of shrimp, but other than that, it's been business as usual.
Okay, thank you. And I would just like to acknowledge Julie's, very valuable service to the Alliance and especially the town of Shrewsbury. As you said, she's been invaluable in terms of taking care of our Title V septic system inspections and whatnot. So thank you, Julie, for your 10 years of service, is it?
10 years.
10
Yep.
years. Thank you, Julie. Are there any other comments or questions? Okay. If not, then I'll move on to review our meeting schedule. So we have maybe January 13 or 20.
Yeah, 20th or 27th, either one day works. 13th might be a conflict.
20, okay.
20 is fine with me.
Check. Yep, that works.
Okay, so we will have our next regular meeting on January 20th, 2023 at 8 a.m. Okay, if there's nothing else, do I have a motion to adjourn?
So moved?
I'll second.
Okay, all in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Myself, aye. The meeting is now adjourned. Thank you, everyone. Thanks for being here.
Wish everybody happy holidays.
Yes.
Happy
Yes.
holidays, and Merry
Thank you.
Christmas. That's
Yes.
right.
Thank you.
Thank you.
That's it.